Thank you so much, Balaji, for joining us this afternoon. We really appreciate you lending your time and expertise to members of the Hack the Curve hackathon. So just to kick things off for everyone, allow me to take the opportunity to introduce you to our speaker today. So Balaji is an alumni of the DMZ. Not only an alumni, he is also an old entrepreneur in residence and one of our current alumni in residence at the DMZ. So I think you've done the full gambit now
I
at the
have.
DMZ. The only thing is for you to come and work as staff now.
Yeah,
So,
I can make an open coffee. We can do that sometime.
but beyond that, so Balaji is the co-founder of Medstack, which is, and I'll allow him to go into this a little bit more detail, but essentially, and I'm going to butcher this for you, it's a platform that basically allows you to develop your healthcare startup with all the different types of rules and regulations in mind. So when you're looking at HIPAA or other potential regulations you may fall under. And so with Hack the Curve, since a lot of you are developing healthcare solutions, if you don't have that experience in this field, because there are a lot of hoops that you have to jump through, and I'm sure Balaji will go into this in a little bit more detail, there's just some really important things you need to understand as you're embarking on this, and things to put in place today so that it doesn't potentially affect a sale, a partnership in the future as you are going through the due diligence process or the sales process with a customer. So he's got many years of experience, has been through quite a few accelerator programs as well. But without any further ado, we really appreciate you taking some time to do this talk. And then, of course, for those of you on the Zoom webinar, please feel free to put questions in the chat and we can either address them during the presentation or save them to the end. But without any further ado, I'll pass the floor over to you. Welcome and virtual applause for joining us today.
Thank you so much. It's a pleasure to be here. Thank you to the DMZ, first of all, for the initiative on Hack the Curve. Obviously, I'll talk a little bit more about this, but this has never been a more relevant or important time for digital health to step forward, and also for giving me the opportunity to speak. So I have a few slides to kind of guide the presentation today. Can everybody see my slide deck? Does that come up okay? I'll take the silence as confirmation. Yes. All right. So today we're going to talk about infrastructure, privacy, and security in healthcare, which is always an important conversation. I think it has some interesting lenses given what's going on now. I'll actually kind of track this back to the relevance of digital innovation in healthcare itself and how that leads to a conversation on privacy and security. I will talk a little bit about what we do sort of at the end at Medstack. This is the space that we operate in. But looking forward to the conversation, looking forward to learning a little bit more about what you guys are planning to build and certainly the discussion. I'll try to get through this relatively quickly so we have some time for some Q&A afterwards. So just I guess a little bit about me. Shane did a fantastic job with the introduction, but my name is Balaji. I'm the co-founder and CEO of Medstack, and I've been around in the entrepreneurship space and the digital space for the better part of a couple of decades, I guess. Always with a great interest in platform technology, and I think the role of platforms or enabler technologies and enabler businesses to help with the transformation of very complex industries is a part that sort of fascinates me the most. And healthcare is certainly one of the most complex that you can think about. So some of the things we're going to talk about today. We're going to talk about why digital health and when we think about the industry and how it looks at digital technology, how does it prioritize what it's going after and what matters. We're going to talk about how the industry views data and information, categorize it from a legal perspective, and how they look at it. We'll talk about enforcement rules. We'll talk about what this means living in this environment, working in this environment from the perspective of you being an entrepreneur and trying to commercialize a new product and bring it to market, and what their expectations are around how you're handling the data, and then the kinds of things that you need to say and do to be able to commercialize. So these are the two takeaways we want you to have at the end of this workshop. So the first thing is, let's go right back to why digital health in general. And this is kind of even before February of 2020. And I think we need to talk about that as well. But generally, the big kind of driver for the digital health industry is that healthcare itself was built for what you might call very transactional type experiences. So, you've had an injury, you've broken your leg, something to that degree, you go and you get it fixed, then you carry on with your day. But now we're in a world where the health of humanity has evolved, and the biggest spend in healthcare, which is the amount of money that countries spend on healthcare, is chronic conditions. And so chronic conditions are things where the medical condition is complicated, the relationship with the patient is much longer, and there's a lot of people sort of involved in the care. And this complexity has actually led to a lot of exponentially rising costs in healthcare. And part of the reason is the tools that the healthcare practitioners have to work with patients are starting to become a little bit limited in this context of these very complicated conditions. And so the first foray into sort of bringing healthcare to the digital world some 25, 30 years ago was the introduction of the electronic health record, which was the right first step. It would say, hey, let's move beyond paper records in a filing cabinet to a world in which there's this digital record that talks about, my name, my address, my medical conditions, my appointments, my prescriptions, my lab results, and all sorts of other things. And what that's done is if you look at surveys of doctors, they'll basically say that the introduction of the EHR has improved the quality of documentation, but it's actually not really reduced the work or improved the quality of patient care. In fact, things have kind of become more complicated. And it's not to say that the EHR was the wrong investment, but maybe it wasn't all of the investment that we need to do. And so then if you sort of say, well, those are for technologists, and I'm a technologist who came to healthcare rather than the other way around. What do modern digital technologies do that can address these challenges? And the cloud is really sort of the driving force behind a lot of these things. And I tend to think of them as sort of like three major things we do. The first is that now with data being in a place that lives on the internet, we can deliver care in more places to more people. And so whether that's, something as complicated as stuff like robotic surgery to something as simple as, well, being able to, arrange over remote distances what time you're going to see a patient. Now the whole process becomes more efficient. The second is we can now make decisions faster. Healthcare has always sort of worked on the notion of precedent and large population data. Well, now you have a much larger population, a much faster ability to make decisions. I don't believe AI is going to replace doctors, but they've always leveraged pre-existing data to help them make decisions better. And now we have tools to help them do that, starting with things like, image recognition and things like that. And finally, this is still an industry that really kind of does a lot of work with fax machines and pagers. And boy, has that ever come to the forefront in what's happened in the last couple of months. So now with efficient sort of digital workflows, we can move towards more modern interactions in a very important environment when there's lots of people involved in care, not just doctors, but therapists and long-term care practitioners and the family members, et cetera. And so this is why there's a view towards cloud technologies in addressing the transformation in healthcare. But now we're in an environment where this thesis has become more relevant than ever before. And if you look at, I'm sure we're all watching the news every single day, there are some key things that have sort of popped up that's really elevated the importance of digital health. And the first is, we need to make sure we can expand our ability to do testing on the virus, for example. Well, moving beyond a world in which we have to ship off testing kits to a very few number of labs around the world becomes an important step towards this. Of course, there's a company in Ottawa that's doing some really great work in this space. How do we make sure that we don't require everybody to go to the hospital, not just for COVID-19, but for anything? And so the importance of things like, home care and house calls and Uber sort of approach to delivering care to where people are, as opposed to a few central locations, becomes that much more important. How do we engage with patients digitally? So telemedicine has had an absolute explosion around the world in the last month and a half. And of course, there's some great companies in Canada that are doing some really important work in this space. But not only that, but home monitoring for chronic conditions. So, how do you have systems in your house that measure your medical condition and tell you, in the simplest sense, whether you need to go to the doctor or not, if you're, say, recovering from a heart attack, for example. And then, of course, all of the work in medical research, whether you're talking about big pharma or you're talking about startups, this being driven by data and AI to help us get past this with the vaccine has now become more important than ever before. So that's kind of an introduction to the role of digital in the healthcare realm. Now, if you're operating in the space, which of course as a participant in the hackathon you will be, there's a few things you need to do. We're going to start with some basic kind of definitions. The first is when people say you need to manage PHI properly, what's PHI? Protected health information. Probably the biggest misconception we have here is that people, perhaps understandably, think of PHI as just medical stuff. Well, I'm not telling anybody I have diabetes, or I'm not telling anybody what my blood pressure was, or my count of this or that biomarker. So therefore, I'm not worried about PHI. Well, PHI is like anything about you. Your name, your location, your phone number. These are all considered to be protected health information if they involve the healthcare industry in any way, including you talking to the healthcare industry. So that's kind of a very not exhaustive, but basic list of things that we think about as PHI. Quite often we'll get the response of, well, I don't need to worry too much about compliance because I'm dealing with anonymous data. Now, this is a very big topic from the digital security and privacy realm of people. But if you do a little bit of reading on this, you'll see that the community doesn't always buy that answer, because the problem is that if you know some basic information, if it's been anonymized, and then other information which you could do from social media, whatever, it becomes very easy to put things together. And in the digital realm, some of these tools allow the aggregation of data post-fact, which can then risk the ability for us to keep things anonymous and private. The other term you can hear a lot about is HIPAA. So the very first thing you need to understand if you want to make sure that people are thinking that you're taking this stuff seriously is to know how to spell it. HIPAA is not two P's and one A. HIPAA is one P and two A's. And you would be amazed at how much marketing collateral still gets published with that incorrect. And the reason you have to get it correct is because it's actually an acronym. So the most important thing to understand about HIPAA, first of all, HIPAA is a US thing. From a legal perspective, it doesn't apply in Canada, but people talk about it everywhere. And it was created by the US private health insurance industry. Why is that important? That's important because these are private for-profit organizations. Anthem, United Healthcare, and all of the others. And so therefore, the biggest thing they're worried about is a risk to their business model. Well, if health information is not protected, it becomes very easy for people to create insurance fraud. And so these organizations kind of got together and said, well, we need to make sure there's a way of protecting people's information. And by the way, HIPAA predates digital. It actually is older than Google. And so it was not created for the digital world. It was created for any data, including data on paper. And it's a set of practices that sort of says, here's how you have to handle data. It was amended in 2009 with an act called HITECH, which really kind of put forth the notion of how do you manage things like breaches and enforcement and who can actually enforce HIPAA. So that's actually what it stands for. But when we dig into it, what's it actually asking you to do? The first thing you need to understand is that HIPAA governs healthcare organizations, accountable organizations. So if you are a digital health company, in other words, you're creating an app that patients use, for example, it's not that you don't fall under HIPAA, but you don't need to worry about the Office of the National Coordinator in the US going after you. But the thing you need to realize is that your customers, your B2B customers, hospitals, insurance companies, public health organizations, clinic networks, medical research, big pharma, they're all governed by this. And they have a responsibility for the people in their organizations. And those people will be the people using your app. And this is why this stuff is actually relevant. So generally, HIPAA is asking for a few kind of very specific things. What we're asking for is, who has access to the data? How did they access it? How are they given access? How do you track when and how they access the data? How do you revoke access? What do you do if there's a breach, and how do you protect and back up the data? This is really the net of the kinds of questions that HIPAA asks about. And you can imagine what this looks like, whether you're talking about a scan of a form that somebody fills in a doctor's office or a digital record. that might be created by a piece of software. And the reason everybody kind of talks about HIPAA is because even though it's a US thing, it is around the world generally considered to be the best documented and most stringent digital privacy law pertaining to healthcare data around the world. So much so that everybody uses the term for healthcare compliance, even in places outside of the US. Oh, I need to be HIPAA compliant. Is this HIPAA compliant? Yes or no? I have doctors here in Canada who only practice in Canada who use words like that. The second is a lot of countries that don't have these laws are creating their own and they're mapping it off of HIPAA. When GDPR was created and enacted in May of 2018, it caused a huge panic in the digital innovation world because of its complexity of implementation. It's hard for everybody, but people who were operating in healthcare were actually 80% of the way there with the kinds of things they need to worry about. Just for completion's sake, let's talk about Canada. Canada is different in the US. HIPAA is a federal law that applies across the country in the United States. In Canada, as I think a lot of people have come to learn in the past, couple of months, we have a general privacy framework called PIPEDA. I don't remember what it all stands for, but the EDA stands for, or PEDA stands for Privacy and Electronic Documents Act. That's not healthcare specific, but it just talks about the rights of Canadian citizens to manage their data privacy. And it governs the things that you see all out there. And then healthcare is managed provincially. So each province has a set of laws around how healthcare is delivered, how it's budgeted, how it's managed, how it's organized. Whereas Health Canada is more responsible, like the FDA, for things like what's safe and what's legal to use. And so each province has their own set of regulations. Because we're in Ontario, we hear about PHIPAA all the time. I know it's very confusing. You have HIPAA in the US, PHIPAA in Ontario, and they have nothing to do with each other. They just sound the same. I've heard it also expressed as FIPA, which kind of bothers me, to be honest. Generally speaking, from a digital app perspective, most of the regulations across Canada are going to be the same. There are some minor nuances. So some things have to do with breach notification, et cetera. And perhaps one of the most relevant questions that comes up for those of us operating in cloud digital software is, does the law say the data has to be stored in Canada? Do the servers have to be in Canada? Legally, the answer is actually depends. It's not the same in all the provinces in Canada from a legal perspective. However, the hospitals and the other healthcare enterprises generally expect it, whether or not it's legally required. Just continuing a little bit, so we kind of get a full kind of glossary on this stuff. Let's talk about GDPR. GDPR was a new regulation that came out of Europe. Brexit certainly has put GDPR in an interesting context. I think it's still up in the air whether the UK will continue to follow GDPR as written or will create its own law. Global data protection regulation, and it basically covers the same kinds of things that HIPAA asks for. It's not healthcare specific, but one very important point about GDPR is that it doesn't govern a country. It governs the country's citizens no matter where they are in the world. So if we have somebody from Portugal who is visiting Canada, that citizen has the right to be protected by GDPR even while they're in Canada using apps that are running on Canadian servers. Generally, data protection is all the things that need to be managed, but GDPR has its own very unique requirement. And that requirement is if that citizen says, I don't want to deal with you anymore, please delete any record you have of me, including all of the backups, you kind of have to do it. Now, this has created a huge stink in the digital world. It's a great idea. As a privacy advocate, I love it. And it's where things should actually go. But it's really, really, really hard to implement. And in actual fact, that it has some violations against HIPAA, who says the data has to be backed up to service the healthcare industry. So people are still kind of trying to figure this stuff out. But that's really what GDPR says, the way it's written. And if you want to claim that you're GDPR compliant, you should at least have a manual way of doing that if you were so asked. And then let's talk about a couple other things that are relevant to healthcare. SOC 2 is not it's not a law. It's an industry certification that governs practices and discipline around security and privacy. Where you will run into this most of all will be with hospitals, primarily US hospitals, where they'll kind of go, hey, what are your plans for SOC 2? We require our vendors to be SOC 2 compliant. Do you have to be SOC 2 compliant on day one? Probably not. They'll just go, do you have a plan for it in the next couple of years? It's complicated and it is very expensive, which is why companies that achieve it, including us, recently, usually do some marketing around the fact that they have it. And then I also want to talk about high trust. High trust is a really interesting thing. High trust is not a legal entity from the perspective of it being a government agency. It's not. It's a private organization. It is a consortium that was created by a number, again, of the big US insurance companies. But the reason it was created is because the problem with HIPAA is there's actually no certification for HIPAA. Anybody ever tells you they're HIPAA certified, that doesn't mean anything. It might have been that they were privately audited by somebody, but there is no stamp or certification you can get for HIPAA from anyone. The way it works is that HIPAA is a law that governs the hospitals. They will be periodically audited. I'll talk more about this in a second. And they will then interpret that and create a set of requirements for you to follow to work with them, which map to these kinds of things. Well, because that's such a complicated process, the insurance companies got together and created a certification called High Trust that says that if you are High Trust certified, and they have auditors who do it, and you get a stamp and a certification, that means that you meet their minimum requirements for their interpretation of HIPAA. Here's the problem with High Trust. High Trust is very, very, very expensive, and it's very complicated. The set of controls is enormous. It's all digitally run through their own tool that they sell. And it's tough. And anybody who's ever done it, nobody's ever happy about it. They're always complaining about it. But when you have it, it becomes kind of a big deal, and you will be required to have it if you sell into US insurance. Could this ever come to Canada? Potentially. Canada Health Infoway tried to do something similar to this. Didn't really take off. But we've been working with the High Trust Alliance. Our platform is High Trust, complete certified from an audit perspective. We don't have the certificate yet, but that's just process. But something you should know about. You will be asked about it. And then finally, just to kind of look at the edges of this kind of thing, we have new stuff that's happening. So I think one of the most interesting things that's happening in healthcare, in digital health, is this notion of a digital therapeutics, or a DTX. A digital therapeutic is an app with a workflow for a patient that if they follow the workflow, it's kind of like them taking medication. And from that perspective, what it actually is saying, hey, we know if you follow this regimen, you can generally expect these kinds of results. If you can prescribe exercise or medical device or therapy or medication to a patient, why can't you prescribe an app? Especially for things like mental illness, where they might be going through therapy. So there's been pursuit of this new area called digital therapeutics. And the really unique thing about DTX is that they're actually certified by the FDA and Health Canada, which means they can be prescribed, covered by insurance, and doctors can be reimbursed. It's a very new field. There's not too many companies doing it. There's a couple of bleeding edge conferences around this stuff, but they've just started. And here's kind of where it is. So they created a consortium in 2013 to try and figure out how to do this. And so they've actually certified a few apps. One of the minimum requirements is full HIPAA compliance. But generally what they're trying to do is, do you have evidence to show that using your app achieves a certain result? And a lot of it has been around chronic conditions and mental illness and things like that. So if you're in the space where you're providing a regimen for patients, eventually one day you might want to look at becoming certified as a software as a medical device. Okay, so now that you've got the definitions and the vernacular, let's talk about some common misconceptions amongst the digital innovation community. I can talk about this stuff because this is my beef list, right? So the first is, I'm using AWS, and AWS is HIPAA compliant, and so I am too. No, you are not. And I'll tell you why in a second, but basically the Coles Notes version of that is they're compliant. You have to use their compliance to prove your compliance, but just because they're compliant doesn't mean that you are. You basically get about 20% of all the things you have to do to be compliant. So, take that to heart. I built my app, so I don't need to be compliant. This is actually the data anonymization idea. But as somebody with a background in product management, I think you guys heard my intro that I used to teach product management as well. This bothers me because you should always build your features to the optimum use and application to the problems your customer have. Building around features or taking features out of your product so you don't need to worry about compliance is actually hamstringing your value proposition, and it's not going to carry you that far. Consumers don't care about privacy compliance. Yes, they do. We all saw what happened with Facebook and Cambridge Analytica, or Life Labs, or Under Armour, or the list goes on and on and on. EFAX, a few others. So I think this is an antiquated notion. I'll just have a lawyer write up some documents for me. It's great, you'll have the policies, but it doesn't prove that you're actually doing anything. And so you will occasionally get it, running into people who will sort of say, well, no, prove to me you're actually doing what you say you're doing. And then this is a slide I actually just added just before this meeting, because I thought it was important to say, there is a notion out there that in the current crisis, we don't need to worry about privacy anymore, because privacy slows things down. Security's hard. It's annoying. It's heavy, and we got to move fast to protect all of the people that are suffering from this pandemic. So I did a bit of research on this, and the good news is that we're not lacking information. Pretty much every privacy organization around the world has said something about this, including the people behind PIPEDA, the people behind GDPR, and the people behind HIPAA. I've summarized it. It basically looks like this. What these regulations are saying, and allowances are in the current pandemic situation, or what they call any public health crisis, is that they're allowing, for example, healthcare workers to do what they need to do to get a hold of consumers. So one of the biggest things is that healthcare can now, at least for now, use things like FaceTime and Zoom. Now, of course, that was before all of the stuff that happened with Zoom and privacy. We've done a big blog post on that if you guys want to learn more. But the point is that publicly available tools are usable from the perspective of communication with patients. However, that doesn't mean that the privacy laws have gone away. They're all still in place, and you as a creator of new technology are expected to follow them. Government authorities may actually seek your assistance and accessing your data to help curb the spread of the pandemic. But they will do that in a very theoretically, at least, a very transparent manner, following a specific process, which with documented and regulated and approved exceptions where necessary. Doesn't mean you are not, beholden to the laws. It just means that they will do what they need to do to keep people safe. Finally, some of the offices are closed because people are working from home. So the resolution around escalations and privacy violations may be slower, but the records will be there and they will happen. And this is kind of my conclusion around how this stuff has actually moved forward. It's changing day to day, but that's sort of where we are. So if those are the laws, then what does the healthcare world react, and how does it think when it's looking at third-party technologies that might be created in a hackathon, for example? Well, one place of inspiration you can look to is go right back to the creation of modern healthcare, which is the oath that doctors take when they become a doctor, called the Hippocratic Oath. And in the text of the Hippocratic Oath, it was amended in the 1960s. It actually mentions protecting privacy of the patients. That's how far back and how deep this stuff goes. So you can tell what the philosophy is. Another way of reflecting this is that every year they do an interview on hospital CIOs and say, what are your priorities, right? Given the world that we're living in. And so, some things come up every single year. Yeah, we want to engage with patients more. We want to have digital health records. We'd like to be able to use AI. We're pursuing value-based healthcare, which is we want to make sure that our work is actually making people healthy and that they're actually coming to healthcare less often because they're retaining healthy. But number one, every single year, they're concerned about privacy and security. It's still at the top of the list, and this has not changed in the current environment. Here's why. Because with the enforcement laws that came in 2009, the fines for HIPAA violations continue to go up. Every year, more and more people and organizations are being fined for things they've done wrong with HIPAA. And you can see some pretty big numbers that have happened over the past few years. And healthcare is always bleeding for money. And so they're now in this tough situation where they need more digital technology, but they're afraid of who they work with, because if they work with somebody who hasn't done this correctly, it's their head as they get audited from the Department of Health and Human Services for how they've protected data or haven't. So as a result, you have to meet a pretty high bar to pass their minimum standard so that they can work with you in an environment where sales cycles are already really, really long, even when we're in a public health crisis. And these are some of the things that they're going to ask you, have you done? Well, the problem is that it's really expensive. And typically, only about 5% of digital health companies do this correctly. You already waited so long to get the meeting with the innovation officer at the insurance company, and then they go, I love what you've built. It's amazing. It's going to help our members. It's going to help our patients. It's going to help our doctors. It's going to help our assessors. But I'm not allowed to work with you because it's too risky. You didn't pass the audit for my head of security, head of privacy. And they don't care whether I work with you or not. They only care about protecting their responsibilities around data security. So, I wanted to work with you, but I'm not allowed to. So how do we tease this apart to make it easier for you guys? And we think of compliance as a stack, which is kind of where our name comes from as a company. And this comes back to what I said about whether using a public cloud provider is enough to make you compliant. So if you think of compliance teased apart as the questions you will be asked by a hospital or insurance company when you're working with them, these are the kinds of things they're going to ask you about when it comes to data in the cloud. First of all, are you using a physically safe place? In other words, are you using a major cloud provider? You cannot really easily run digital health on DigitalOcean. You need to use AWS or Google or Amazon or somebody like that who has a HIPAA attestation, what they call a business associate agreement. Secondly, okay, that's great. It's in a physically safe location, but what about when the data moves around? Encryption, backups, audit logging, network security, certificate management, key management, port control, monitoring, internet proxy. And this is all the stuff that you have a couple of ways of doing it. One is you have a dedicated DevOps infrastructure security team who configures all this stuff on the cloud. There might be another opportunity, but this stuff is a lot of work, and that's where that 5%, the 95% failure rate comes from, as well as the $100,000 of cost. And this is nothing to do with what you're building. This is just stuff that you're going to do to configure the cloud to make it work. And then finally, you have all the documentation that proves that you're doing the stuff correctly. All the policies around all those things that you said you're going to do with the data, and then all your people, their laptops, your office, HR training, how do you create and destroy paper records you might have, passwords, etc. So as a digital health founder, you're kind of stuck in a dilemma. Do you build your app to try to avoid the requirement? Do you hire a very expensive privacy consultant who'll tell you what to do, but then the next time you change your app, you might actually break it and you got to rehire them? Do you hire a team? No, nothing says you cannot do this stuff. And many people do. You just hire a whole organization of people who are in DevOps, infrastructure, security experts to do this stuff, as well as privacy lawyers to work with. Or maybe there's a platform you can work with, which is, yes, very transparently, a little bit self-serving. But I've gone through 90% of my slides. I'll spend the last little bit talking about what we do if you guys are interested. So my company is Medstack, and we are that bottom right-hand corner. We automate all this stuff without taking away the uniqueness of what it is you're building. And this is how we do it. So we're providing a set of things. The first is configuration of the public cloud to build in all of these protocols, security protocols, and we lock it down so you can't actually change it, which means we can pre-write all of the documentation and it applies to you automatically, and we can keep it up to date irrespective of what you're building. We can give you all those proof points even before you need infrastructure. You can say, here's how we're going to do all of these policies, and we're ready to answer the questionnaires you have in terms of how we're going to do compliance when we go live, because we have all the policies written up. We give you tooling to deploy your application into this infrastructure, and of course, all of the policies reflect security practices that are built in and monitored by us in real time and managed by us. We do this for a whole bunch of companies, and I'm really, really pleased to say that a number of our customers are actually doing stuff specific to the current pandemic and doing so in a manner that protects the data of their patients and users. Telemedicine, medical devices, chronic condition management, healthcare coordination and billing, and more. AI, VR, blockchain, and every other buzzword you can think of. And that's us and what we do. If you're interested to learn more, I'd love to chat with you guys. Happy to answer any questions you might have.
Awesome. Thank you so much. So we already have a few questions coming in from the audience that I'll read over to you. But I think the first question that I really have for you after this presentation is, I'm pretending that I'm participating in this hackathon. We just came up with the idea. We're now trying to validate that there's actually a market or an opportunity here. When do you think it makes sense for us to start to think about, okay, there's something here. Now, when do I incorporate some type of, privacy and security incorporation into my business? Just because I could see people, on the other side of the screen being like, oh my God, this is so much information. I'm never going to work in healthcare.
Yeah. Great question. And it is really complicated. And one of the things that inspired us to create Medstack are all these great stories we hear from experienced entrepreneurs and coders and innovators and designers, thought leaders, even investors who used to be entrepreneurs who go, hey, I had this experience in the healthcare industry. It sucked. I wanted to be better. I had this great idea for a healthcare app and I didn't do it because healthcare is too hard. Healthcare is hard. But it's hard for very important reasons. Like this stuff is, what I want you guys to take away is not that security and privacy is bad. It's there to protect all of us and it's really, really important. The worst thing that could happen is not even that people don't build stuff because healthcare is hard. The worst thing that could happen is they do build stuff with poor security practices in place and then it puts us at risk for using it. That's what scares me more. But there's an order of operations, as you alluded to, Shane. So I think, the thing to realize is the reason we can do a platform is because the privacy and security work that's required doesn't really have a lot to do with what you're specifically building. It's just a set of minimum requirements that everybody has to follow. So what you should do, which is what a lot of our customers do, is that you build your workflow in your demo, showing the patient experience or the provider experience or the assessor experience, whoever the case might be. Get engagement from the healthcare industry, whether it's patients signing up for on a landing page if you're doing a B2C type thing, or whether it's partnership with an academic institution, or whether it's engagement with a healthcare enterprise, to just gather their interest. Now, as part of that, you want to deliver a message going, we are promising we're going to build this in a way that will be compliant, and we're going to follow all of your regulations and your expectations. You don't have to have all of that stuff built in on day one, but you have to tell them that you're going to do it. And actually, we have a facility that allows you to deliver all of those policies even before you have infrastructure. Once you have somebody going, great, I'm going to work with you. Now, before we put live, real patient data on the platform, you need to pass this audit as a security and privacy professional. That's when you build the compliance stuff into the platform. The good news is, working with us, or even really kind of achieving compliance anyway, you don't need to build it into your app. You just have to build your app in such a way that you can add it on top, which is what most people do.
Okay, got it. And so the next question, and to the asker, I'm going to change it a little bit to make it more relevant to everybody. But, with COVID-19 going on right now, people are interested to sell to clinics, to hospitals, to government, but, there's a lot of, they're busy, I think is the best way to put it. So how do you break through the noise? How do you reach out to, whether it's a hospital, a senior's home, a doctor's office, in today's climate, to try and convince them that what you have would benefit them when they're running at 3,000 miles an hour right now?
Yeah, it's a good question. It is, there's not really a silver bullet. It is really, really difficult and generally, challenging. Candidly, I'll say it's even more hard in our environment here in Canada because, of the way that healthcare works and the ownership and administration of healthcare. It's funny because I sometimes talk to people in the US and they go, oh, it must be so easy in Canada being a digital health founder. I'm like, why? I said, well, because you only have one customer. You can just get that customer and then you're set. And I'm like, yeah, but that customer is the government. How easy is that to do? It's not easy. But I think one of the things that I'd like to really congratulate our community on has been the recognition of the importance of innovation in addressing this crisis. And so there are tons of calls for innovation out there, stuff from the government, stuff from investors, stuff from healthcare practices. We've actually been trying to track down a list of all these things where they're asking early stage entrepreneurs and even people who are not even in companies yet, who've just got ideas, who are so inspired, the ideas they have, so they can fast track some of them to commercialization. You know, the usual sales process is much tougher. You need to get in front of the chief innovation officer or the innovation department and show them what you're having. But in this environment, if we're working on things in response to the pandemic, there are some additional options out there, you know, that are available, and some, you know, some really interesting things. Even if you just go to government websites, you'll see a list of calls for innovation for this kind of thing.
Yeah, and if I can build on that, because I think that's a really important note. There have been a lot of organizations that have put out calls. You know, the DMZ with Hack the Curve as a perfect example, but you know, a pretty well-known healthcare company, Roche, also put out their own innovation challenge where they were awarding up to $100,000 in grants. And so, you know, since there is so much noise, I think what you really want to do is how can you perhaps piggyback off of people who have done that work? So, you know, are there programs like the one with Roche, like the one with the DMZ, where they're going to be introducing or bringing in these experts to help you along that process? I think there's an opportunity to capitalize on that. That doesn't always necessarily happen. You know, traditionally these programs happen at a specific set time. Well, this has now happened today for COVID-19. So what organizations are doing things that have relationships with the people that you want to reach out and talk to? Utilize that as a strategy, because yeah, I would probably think that if you tried to call a hospital right now, they ain't picking up the phone.
Yes. Yeah, exactly. I think there's other forces that are working with these healthcare organizations to help them with their adoption of different things that become a really interesting way of looking at this stuff.
So one of the questions, this was actually the very first question that we got at the start of the presentation, was if the platform is used by a health professional to store, process, and analyze health data, but the data is stored either in the doctor or the patient's local database, you know, do the same privacy regulations still apply?
Yes. Well, okay. So I think it depends on the way you answer the question. The doctor, even if it's a single doctor operating in an independent clinic, is a healthcare provider, and their license beholds them to being compliant to the laws. Is the government going to call every individual doctor and do an audit on their privacy and security? I mean, I wish they would, but they probably won't. But doesn't mean that it's not expected. As a patient, if you are storing your health data on your own in your house on a hard drive in your living room cabinet, that's totally your right. In fact, nothing gets governed by the laws of healthcare until it touches a healthcare organization. This kind of dovetails into a slightly different topic, which I won't spend too much time on, but I'll just touch on because maybe people are their heads are kind of going that way already. One of the questions that a lot of people who are not in the healthcare industry traditionally, but have engagements with as patients or family members, as we all do, gets really frustrated because why can't I just take my data and show my doctor and, you know, and get them to use the data? Well, you can't, because they are responsible for the decisions they make on the data, and the data wasn't theirs. And so this is the notion of the personal health record that a lot of people are trying to solve for a really long time. In other words, can my doctor use my Fitbit data? I think the work that Apple is doing with Apple Health is probably the first step in the right direction to do this. They've had partnerships with a key small set of hospitals that allows their health record on the iPhone to be used by the doctor, but it's a very complicated process to make it work. Not to say we shouldn't try. And I think there's some unique use cases in which the personal health record works, but this is the thing that's been kind of slowing it down. It's not a technical problem, it's more of a political one, but it's a problem that we often get asked about in this environment.
And so, you know, this is one, and this is where you can kind of put on your futurist hat or your forward thinking hat, is, you know, just based on your experience and what you've seen with trends, whether it's pre-COVID or during COVID, you know, some of the people in the hackathon are trying to think of what is that next innovation for healthcare. So do you have any thoughts on where you see the world going because of this whole situation?
Well, oh boy.
Yeah, not a loaded question at all, you
You
know?
should have sent me that one ahead of time.
Hey, I just got it live on the Q&A, so.
Where do I think healthcare is going? Okay. Yeah, no, it's a great question. I had a long conversation with somebody about this the other day. There was a reason I presented my slides in the order that I did. And I think we've had this capacity challenge problem in healthcare for a long time with the prevalence of chronic conditions. You know, it's just been exponentially growing in the last 25 years with the spread of heart disease and diabetes and mental illness, you know, which is just such a huge problem these days and seems to be getting worse and worse. And then an aging population. An aging population means more chronic conditions, right? I have elderly parents who live with me and they suffer from a number of different things in this realm as well. And the healthcare industry wasn't built for it. How do we as patients see that? Like, how do you guys know I'm telling the truth? Well, long wait times. You know, that's one. It takes forever to get an appointment for some things here in Canada, and that's not criticism of our healthcare system. It's just it's not built for it. In the U.S., this is a challenge with the fact that many people don't even have health insurance. It's expensive, and you know, I won't get into a political debate of private versus public healthcare, but we have a public healthcare system in Canada. It costs us as taxpayers a hell of a lot of money. In the US, they have private healthcare and it costs people a lot of money individually, and some people don't even have it. And so the system has to be thought of differently, but technology can create efficiencies that address that problem specifically. I'm not concerned about money, more about, are we delivering better care to more people faster? And so, you know, digital workflows, home monitoring, concierge healthcare, home care, telemedicine, all of these things were created to address these gaps. And I mean, look at, if I can call them out specifically, you know, look at Maple here in Canada, who's one of our customers and our good friends. And I can't tell the story better than Brett and his team can, but Brett's a physician and he created that company out of frustration with, you know, with not being able to deliver the kind of care that he thinks the healthcare system should deliver to its patients. And so this was the driving force. But I think now these things have all been there in an industry that has never been that quick to adopt technology. The healthcare system being driven by, you know, very old, heavy policies and a lot of red tape and very complicated approval processes, doesn't adopt technology very quickly. Much of the healthcare challenges are with patient populations that may not be that tech savvy, so they don't adopt things that quickly. It's not like financial services, which, you know, has, I think, some different levers in it. But now we're being forced to, you know, because we have to be socially isolated, because we have to find a cure faster, because we have to scale our ability to deliver things like testing faster. And so now people will start using these things and they've never used it before, and it's going to end up in a new normal. Is the massive uptake in digital health that we're seeing now going to maintain? Probably not, but it's not going to go back to the way it was before. There's going to be great interest in video technologies, and remote technologies, and AI, and in consumer-friendly workflows in healthcare that we've never seen before.
Okay, and so just one last question before we wrap things up, and I think this really, you know, transitions over nicely from the conversation of where things are going. The next one is OMA released a virtual care guideline as an excellent resource. However, there's still a lot of assessments that can't actually be done virtually right now. Do you think care will be half virtual and the other half will be in person in the future? So maybe ones that don't necessarily have to be in person, go to the hospital, people will get pushed to do it online.
Yeah. Oh, it's such a great question. If I can tell a bit of a personal story, my partner is a physician, and her nature of the work that she does is largely in person. She does very complicated cases that require a lot of physical assessments, and so, you know, this has been a challenge that's been asked. I'd love to give an idealistic answer that all care could be virtual. I don't think we'll get there. But there's a lot that we've not even experimented with that we will now do so, and do some interesting things. So there's some, you know, some examples I can think of. Our friends out of East Coast of Canada, Sino, provide virtual, you know, rehab essentially. But it's simple things. It's like you're watching a therapist and they ask you to stretch in this way or touch this way and self-assess. But these things work. And, and if you think of healthcare, healthcare is very complicated, but there's simple things in healthcare that can be done virtually. And that allows us to really kind of get better ROI on our spend on the in-person aspects of healthcare for things that are higher touch, that are more complicated and require more specificity. We have a customer in the Valley called Karuna that tests. I mean, you should check out the demo. Karuna Labs. They do some really interesting things. They take advantage of a VR headset to ask people to do exercises to diagnose chronic pain, and it works. There's no reason it shouldn't work. And then, you look at things like sensors, right? So, there's some interesting projects of leveraging things in the home to detect whether people are having healthcare conditions or not, whether it's a watch that detects a senior person who's having a fall, whether it's, detecting a heart arrhythmia, whether it's even detecting things like, your mental state. I think all these things are definitely possible. So I think it's not just that healthcare assessments will move online. I think the process will be reversed and diagnosis will become more automated because of digital technologies.
Okay, perfect. Well, I will have us leave things off on that note. So thank you so much once again for joining us this afternoon. For everyone who is on the video call right now, all of Medstack's information is located at the bottom. So if you are interested in reaching out to them, I definitely encourage you to do so. To chat with them. The DMZ loves them. Have a personal relationship with Balaji being an entrepreneur in residence and an alumni in residence with us as well. But thank you so much once again for taking some time to share with us your insight and thoughts on this. I know that everyone is really appreciative of you donating your time and lending us your expertise. So thank you very much once again. We really appreciate it. And for all of you who are out there, please continue to stay safe and sound, and I hope you gained some valuable insight from this workshop today.
Thank you so much, Shane. Thanks, everybody, and looking forward to seeing what you guys are kind of coming up with.
Okay. Take care, everybody.